Hi, my name is Faina Zabarski, and my presentation is on depression. So, what is depression? It is the most prevalent psychiatric condition in the US. There's about 3 million cases reported per year. The written definition for depression is a mental health disorder characterized by persistently depressed mood or loss of interest in daily activities, causing significant impairment in daily life. It's also known as major depressive disorder, or MDD. In the US, psychiatric disorders are diagnosed using criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5. So the DSM-5 requires a diagnosis of MDD to include at least 5 of the following symptoms during the same 2-week period and present a change in previous functioning. So at least one of the symptoms must be number 1 or 2. Number 1, depressed mood most of the day, mostly every day. Number 2, diminished interest and pleasure in most activities. Number 3, change in weight or appetite. 4, insomnia or hypersomnia. 5, psychomotor agitation or retardation. 6, fatigue or loss of energy. 7, feelings of worthlessness or guilt. 8, diminished ability to think or concentrate. Or 9, recurrent thoughts of death or suicide. So this is very specific criteria used to diagnose depression. Prevalence. Depression often results from or co-occurs with many chronic diseases. So general medical conditions must be ruled out first. That is very important. Depression rarely occurs alone, and people that are being diagnosed with life-threatening diseases such as cancer often suffer from depression as well. Women are more likely to experience depression than men, and both African Americans and Latinos report less depression than Caucasians. So Caucasian women are at high risk for depression. And episodes can last for several months and often reoccur throughout one's life. So someone can struggle with their depression throughout their whole life, and although they treat it once, it can come back several times throughout their life. So as you can see here, there is a chart that depicts the prevalence of major depressive episodes among US adults in 2017. So as you can see, females are at the highest risk, and the age group of 18 to 25 is at the highest risk, as well as whites and Native Americans as well, actually. So depression is said to be caused by neurotransmitter deficiencies or chemical imbalances in one's brain. So specific neurotransmitters such as serotonin, norepinephrine, and dopamine are key players in depression. So serotonin, it is the part of your brain that regulates sleep, appetite, mood, and pain. Low levels of serotonin are linked to suicide. So people with depression have low levels of serotonin. Norepinephrine is a neurotransmitter that constricts blood vessels and raises blood pressure, an anxiety response involved in many types of depression. Dopamine is a neurotransmitter essential to movement, motivation, perception of reality. It's also involved in the brain's reward system, so it can play a role in substance abuse, which many people with depression suffer from. And a dysregulation in the hypothalamus pituitary adrenal axis is said to play a role in depression as well, and that is a marker of reaction to stressors. And as we know, those suffering from depression may not know how to deal with stress accurately. So here is a picture of brain activity in a depressed brain versus a non-depressed brain. As you can see, there is a huge lack of activity, neurotransmitter activity, in the depressed person's brain versus the not depressed person's brain. You can see the not depressed person's brain is all lit up with chemical activity and neurotransmitter activity, and the depressed person's brain has hardly any activity at all. Besides the chemical imbalance in one's brain, depression has many other causes as well. One of them being personality. People with low self-esteem or easily overwhelmed by stress or generally pessimistic are more likely to experience depression. Genetics also plays a huge role in depression. Depression runs in families. So if you have a family history of depression, you are more likely to suffer from depression as well. Environmental factors are an important factor in depression as well. So continuous exposure to violence, poverty, neglect or abuse, or just toxic situations makes some people more vulnerable to depression as opposed to those who live in a healthy, comfortable environment. Medication side effects is also important to think about when dealing with depression. So those dealing with other chronic illnesses or health issues may be on medication that makes them depressed or lethargic or fatigued. It is also important to note that antidepressant medications themselves can cause people to become more depressed, and most of them actually cause people to get worse before they get better. But it is just a period that you have to go through when you are taking antidepressants. And lastly, low social support is a huge problem for those suffering with depression. Many people don't have family or friends to lift them up out of a dark time or keep them going when they're not doing too well. So it's important to have a good support group if you're suffering from depression. How depression affects exercise. One of the most important things to know about someone suffering from depression is that they will be unmotivated. So that is a barrier that one has to deal with when they are trying to get a depressed person to participate in exercise. Other barriers include weight loss or weight gain, sleep disturbances, fatigue, feelings of worthlessness. It is hard to get people that feel this poorly about themselves to want to engage in exercise. So, people suffering from depression require a lot more attention by the exercise professional for support than would a healthy individual. Indecisiveness and difficulty concentrating on a program is another problem depressed people might face. They won't be focusing on the program at hand the way you might want them to. So that is another thing that an exercise professional would have to deal with when dealing with a depressed person, as well as lower peak heart rates, lower peak exercise capacity, and shorter exercise duration. So overall, a depressed person won't be as physically fit as an undepressed person. How exercise affects depression. So exercise can actually alter neurotransmitter functioning. So the chemical imbalance and the lack of neurotransmitter activity that causes depression can be reversed and improved by exercise. Exercise also improves negative evaluations of self, anxiety, and sleep. These are the three major issues many depressed people face, and exercise can combat all three of them. Group exercise sessions are also found to be extremely helpful, and the presence of other participants in exercise is great for those with low social support and help improve depressed symptoms as well. So if you can get a depressed person to take fitness classes, make friends at a gym, that would be extremely beneficial to their depressive symptoms. Overall, exercise just promotes a general feeling of well-being. It makes people feel better about themselves, and it greatly lifts the spirits of depressed people. So exercise significantly reduces depression, and sometimes exercise enough is good enough to combat depression without any other treatment. So how do we assess when someone is depressed? Self-report questionnaires is the go-to in the United States to assess depression. So they assess the severity and presence of the depressive symptoms, and they are filled out by the patient themselves, and it is administered by your primary care physician. It's important to note that these self-report questionnaires should not be substituted for a diagnostic clinical interview conducted by a trained mental health professional. These questionnaires just allow exercise physiologists to develop a plan for action on how they're going to proceed with the exercise prescription for these clients. Some pharmaceutical indications. Antidepressant medications are the most widely used treatment for depression in the US, but most people do not respond or can't tolerate them after a certain period of time, especially when more than one antidepressant is used at a time, because that is found to be more effective than just one antidepressant at a time. So these people are experiencing tons of side effects at first. Common exercise side effects with medication include dizziness and rapid heartbeat. For obvious reasons, this can affect exercise. So that is why they must be closely monitored if they are on medication or depressed and beginning an exercise program. Other treatments. Psychotherapy is a widely used treatment in the United States for depression. Psychotherapy includes cognitive behavioral therapy and interpersonal therapy. CBT focuses on modifying maladaptive thoughts and addressing deficits in behavior. IPT, the therapist forms a supportive relationship with the patient, helps the patient identify interpersonal problems, and uses strategies to develop new behaviors for this patient. Now, the most common and the best treatment for someone with depression would be a combination of psychotherapy, medication, and exercise. So let's take a look at a case study, and let's start with medical history. Miss J is a 62-year-old woman who suffers from chronic fatigue, low back pain, insomnia, anxiety, and most recently, major depressive disorder. The only medication she currently takes is Brintellix for her depression. She never complained of any prior health issues and lived a healthy life until her 60s. She spends most of her time in bed, tossing and turning during the night, and sleeping all day. She isolated herself from most friends and family, is constantly irritated, and has not exercised in years. Ms. J has just been referred to a trained mental health professional to begin therapy for her depression and anxiety. Ms. J's daughter agrees to drive her to sessions once a week to ensure that she goes. Ms. J has been diagnosed with chronic fatigue syndrome by her primary care physician and already sees a chiropractor for her back pain once a month. Our assessment and plan for Ms. J. So, we want to increase low self-esteem and self-efficacy associated with her depression while improving other obvious depressive symptoms such as sleep disturbance, anxiety, chronic fatigue, and as well as her lower back pain. We want to incorporate exercise into Ms. J's everyday life to give her purpose, improve her overall well-being, and most importantly, get her off of her antidepressant medication eventually. Exercise prescription. So to start, I recommend moderate intensity aerobic exercise such as walking and biking 3 times a week for 40 minutes a day. I also recommend resistance training 2 days a week, using machines at first and then progressing to free weights. She should perform 2 sets per major muscle group at her 10 RM with 1 minute rest between sets. I recommend Ms. J join a gym where she could get out of her house and perform her aerobic exercise and resistance training safely and properly with a personal trainer that will keep her motivated. I also recommend Ms. J take group fitness classes offered at the gym, which may help her socialize, relax, and improve her mood. I recommend something like yoga. She should also continue seeing her mental health professional for therapy. This combination of aerobic exercise, resistance training, group leisure activities such as yoga, along with her antidepressant medication and behavioral therapy should be more than enough to get Ms. J up and started with this low to moderate intensity exercise program. Once a routine is set and improvements are seen, we can increase the frequency and intensity of her prescription and slowly take her off her antidepressant medication. Modifications. So, depressed patients require greater attention to ensure adherence to their exercise program since they are at a great risk of dropping out. Depression associated with increased risk of dropout from exercise programs. So, staff should closely monitor these clients and refer them for specialized treatment if needed. And lastly, just be cautious of medication side effects. It is important to remember these people are on sometimes multiple medications at once, and that can cause them fatigue, dizziness, rapid heart rate, so they should be closely monitored to make sure they're staying hydrated and being safe.